Obesity, weight problems in adolescents. Obesity, weight problems in adolescents. Obesity, weight problems and overweight, obese, chubby are the second most main reasons, causes of preventable deaths in America. Stagnant lifestyle, way of life, lifestyle and junk food meals is to be blamed for greater than 300,000 deaths per annum. The sad, unhappy factor is that this problem, drawback, downside, is on the rise. Obesity, weight problems is a chronic, continual, persistent power disease, illness which poses serious, critical, severe health, well-being, risk, danger, threat to the health, well-being of an individual. Also, additionally, obesity, weight problems is the easiest, the simplest, the best recognizable medical problem, drawback, downside, but, however, is could be maybe very difficult, troublesome, tough to deal with. People, individuals, folks usually, often, normally confuse obesity, weight problems with overweight. Overweight, obese, chubby is gaining of some extra, additional, further pounds. A person, an individual is taken into account obese, overweight when the total, the entire, the whole, the full, the overall body, physique weight is minimal 10% p.c. more than, greater than, the recommended, beneficial, really helpful, advisable, really useful weight for her body, physique, structure, construction and height. According to, based on, in accordance with, in line with, in response to, in keeping with an estimate every yearly $100 billion are spent on the obesity, weight problems problem. It is extremely, it is vitally important, essential, necessary, vital to deal with the problem, the issue, as early as possible. Obese, overweight children, youngsters, kids between the age of 10 and 13 have 80% p.c. chances of possibilities of rising into obese, overweight adults, except they change, they modify, they alter their ways, methods and undertake a healthier, more healthy lifestyle. The obesity, weight problems problem, drawback, downside begins from the age of 5 and proceed until adolescence. Obesity, weight problems can be, could be, maybe, might be, will be caused, triggered, brought on, prompted, brought about, induced, precipitated, due to, because of, as a result of, resulting from, on account of, as a consequence of, attributable to, complex, complicated, advanced reasons, causes including, together with, biological, organic, genetic, cultural and behavioral factors. Usually, often, normally, a person, an individual, will get obese, overweight when she consumes more extra calories, energy than the body, physique burns. Also, additionally, there are 50% p.c. chances of possibilities of changing into obese, overweight when both one of many parent, mother or father or mother, dad or mum or dad, guardian is obese, overweight and when obesity, weight problems has affected both the parents, mother and father, dad and mom, the chances, the probabilities, the possibilities will increase to 80%. 1% p.c. of obese, overweight people, individuals, folks can have fats because of, due to, health, well-being reasons, causes, as obesity, weight problems can be, could be, maybe, might be, will be caused, triggered, brought on, prompted, brought about, induced, precipitated, due to, because of, as a result of, resulting from, on account of, as a consequence of, attributable to, few medical disorders. The causes of obesity, weight problems in adolescents are overeating, family, household history, historical past, bad, dangerous, unhealthy eating, consuming habits, little or no exercise, medical illness, sickness, low self-esteem, self-worth, medications, drugs, medicines, depression, melancholy, despair, emotional problems, issues, stressful, tense, annoying, demanding, traumatic, disturbing, worrying, nerve-wracking, irritating, aggravating, hectic, anxious life, and family, household problem. Obesity, weight problems could cause many main problems. A few of them are diabetes, sleeping disorders, issues, problems, high blood pressure, hypertension, breathing, respiration, respiratory problems, issues, emotional problems, issues and improve, enhance in heart, coronary heart disease, illness risk. Teenagers, youngsters are more extra prone to, susceptible to, vulnerable to, liable to, get emotional problems. Because of, due to, the weight, the load, the burden, they develop low self-esteem. They get into depression, melancholy, despair, obsessive compulsion, disorder, dysfunction, and anxiety. Adolescents who want to, need to, wish to tackle, deal with, sort out, the obesity, weight problems, problem, drawback, downside, should, ought to, approach, strategy, method, a pediatrician who will thoroughly, completely, totally evaluate, consider the cause. If no physical, bodily disorder, dysfunction is to be blamed, the weight, the load, the burden is reduced, lowered, decreased, diminished by limiting the calorie intake, consumption, and increasing, growing, rising physical, bodily activity. The doctor, physician can advise, recommendation, a weight management, administration program, and change, and alter the eating, consuming habits of the teenager, slowly. The patient, affected person should avoid, keep away from, oily, fatty, fast, quick, and junk food. The portions have to be, should be, reduced, lowered, decreased, diminished, in order to, so as to be able to, with a view to, in an effort to, with a purpose to, as a way to, with the intention to, decrease, lower the calorie intake. If the adolescent has developed emotional problems, issues because of, due to, obesity, weight problems, an adolescent psychiatrist can collaborate with the pediatrician in order to, so as to be able to, with a view to, in an effort to, with a purpose to, as a way to, with the intention to, make a comprehensive, complete plan for treatment. The plan contains reasonable, affordable, cheap goals, objectives, targets, behavior, conduct, habits, modification, family, household participation, and management, administration of physical, bodily activity. Self-motivation is extremely, extraordinarily, necessary, needed, essential, vital, crucial, mandatory, obligatory, in losing weight. Because, as a result of obesity, weight problems is more extra a family, household problem, drawback, downside, and not, and never, an individual, a person, problem, drawback, downside, the entire family, household can switch, change, swap to eating healthy, maintaining a healthy diet, food, meals, and exercising regularly. This may make the weight, the load, the burden, control, management program a success. Parents, mother and father, dad and mom, can play a significant role, position, function, by boosting the self-esteem, self-worth of their children, youngsters, kids by concentrating on their strengths and encouraging and inspiring them, instead, as an alternative, as a substitute of focusing on the weight, the load, the burden problem. The entire family, household ought to eat meals together, collectively, instead, as an alternative, as a substitute of eating, consuming, individually, whereas watching a movie. This helps all of the members to focus on, concentrate on, give attention to, deal with the food, meals, and the quantity, the amount being eaten. If the teenager isn't getting support, help, assist from his family members, members of the family, she will be able to join, be part of, support, help, assist, groups, teams which can help, might help, may also help, will help, can assist towards, in direction of the goals. After the adolescent has lost, misplaced weight, it is vitally important, essential, necessary, vital, that she maintains it. In majority of the cases, instances, circumstances, people, individuals, folks shift back, again, to their previous, outdated eating, consuming habits after losing weight. That's the reason why obesity, weight problems, is more extra of a lifetime issue. So, the principal aim, purpose, goal, intention of any weight loss, weight reduction program should be make the adolescent like healthy, wholesome food. Should also be made to exercise, train regularly, frequently, often, repeatedly, recurrently, commonly, usually, irrespective of, regardless of, no matter the weight. http://spintaxplurarticles.com/obesityweight-problems-in-adolescence.html